my name is Cliona. I'm a dietitian. A dietitian is a professional who is qualified to give nutritional advice, and they are registered health professionals who are registered with the Health and Care Professionals Council, who keep kind of our standards up and make sure that we are working in an evidence-based and safe manner. I work with young people with eating disorders, and I work as part of the Maudsley Centre for Child and Adolescent Eating Disorders, which is an NHS service. As a dietitian, a core part of my role is working within a multidisciplinary team with a range of professionals that include psychology, nurses, doctors, and the list kind of goes on. Another kind of core part of working as a dietitian with young people with eating disorders is working within a family-based approach, which means that we are always including the family as the greatest resource to the young person in their recovery from an eating disorder.
I'm Namrata. I'm a dietitian specialising in eating disorders. I work in an adult inpatient eating disorders unit. And similar to what Cliona said, we work very much within the context of a multidisciplinary team. When someone with an eating disorder is admitted, we take into account the client's aims for the admission, their loved ones' support and what is needed. We also look at what the community team would like as goals for the admission, and together we come up with a plan that will help with reducing medical risk and also get the client's confidence back up to being able to manage their nutrition and their health outside and continue with their recovery outside. The role for the dietitian would be to think about nutritional risk initially, think about adequate and regular intake, what the risks are in introducing nutrition again, and then continue to work with the client in getting their confidence up, managing independent eating, for example. Eating disorders as a diagnosis is very much criteria-based, so an individual might get a diagnosis of anorexia nervosa or bulimia nervosa, binge eating disorder, or avoidant restrictive food intake disorder, which is also called AFID. Depending on what symptoms they're presenting with, they might be given a diagnosis such as one of these. Disordered eating, on the other hand, isn't a formal diagnosis, but it might be associated, obviously, with an eating disorder. But it might be also associated with things like other mental health conditions, obsessive compulsive disorder, for example, or emotional dysregulation. So people might be eating in a certain way just to manage symptoms that are driven by one of these disorders. With eating disorders, the dietitian's role is kind of set within a pathway, and we follow, as I said, a multidisciplinary way of working. With disordered eating in other contexts, the dietitian might work with the client, coming up collaboratively with what goals they want to work on, obviously taking into account the nutritional risks that is present, but also what the client would like to achieve.
In terms of navigating kind of resources for eating disorders, as dietitians, we know there's a huge amount of misinformation around nutrition on the internet and in other kind of places as well. So a core part that we would always advise anyone that is either in the general public or that's suffering with an eating disorder or feels they might be suffering with an eating disorder is to question, who is the information coming from? Are they qualified to give the advice, and are they experienced in eating disorders so that they can give that specific advice around the topic? Some helpful resources that we can and do point people towards are BEAT, which is our national eating disorder charity, and also the Freed website, which is for kind of younger people in their first episode of an eating disorder. And as well as that, as NHS professionals, we'd always point people towards their NHS kind of website and also their NHS services to kind of seek advice from their GP or the services that can give them tailored advice or guidance on where to seek support.
Although eating disorders and disordered eating can be really distressing for people, and asking for help can be difficult as well, it is really important that you do go and seek help. There is definitely hope in recovery and how people recover. And although it might take time and change is really difficult to manage sometimes. This is really important to note that people who have come to our eating disorders unit being really poorly have gone on to have very full and very fulfilling lives. So please keep the hope up and do seek help.
So to echo what Nam has said, recovery is always possible in terms of seeking help. GPs are the first port of call. And in terms of the other resources that we've mentioned, Beat and Freed, they can be really helpful for those first steps in seeking support and just kind of having an idea of where to even start. In terms of my work as a dietitian and where I've worked, we see young people and families coming in, crisis and in kind of conditions where they're really poorly, but they do go on to have happy, healthy lives and kind of make those connections with life and social connections, and kind of life does become bigger and more full kind of after their eating disorder has been resolved.